Puerto Rico Medical Board style clinical vignette. Potassium physiology, shifts, regulation, and hyperkalemia with characteristic EKG findings. Clinical vignette 1, potassium shift. A 24-year-old man with type 1 diabetes mellitus presents to the ER with abdominal pain, vomiting, and confusion. Labs reveal a blood glucose of 490 milligrams per deciliters, pH of 7.1, and serum potassium of 5.8 milliequal. Despite the elevated serum potassium, the patient is started on potassium replacement therapy after insulin administration is initiated. Which of the following best explains the initial hyperkalemia? A. Excess dietary intake of potassium. B. Cellular lysis causing potassium release. C. Insulin deficiency leading to extracellular potassium shift. D. Decreased intestinal excretion of potassium. Correct answer C. Insulin deficiency leading to extracellular potassium shift. Explanation. Insulin promotes potassium uptake into cells by stimulating the NK-pi ATPase pump. In diabetic ketoacidosis, DKA, insulin deficiency causes a shift of potassium out of cells, resulting in hyperkalemia, even though total body potassium is low due to urinary losses. Giving insulin reverses the shift and can precipitate hypokalemia, so potassium is supplemented. Clinical Vignette 2, Hyperkalemia and EKG Changes. A 67-year-old man with chronic kidney disease presents with generalized weakness and palpitations. He missed his last dialysis session. ECG shows tall peak T waves, a widened QRS complex, and flattening of the P wave. What is the most likely electrolyte disturbance? A. Hypocalcemia, B. Hyperkalemia, C. Hypercalcemia, D. Hyponatremia. B. Hyperkalemia. Explanation. Classic EKG findings in hyperkalemia. Tall peak T waves, early finding, flattened or absent P waves, prolonged PR interval, widened QRS complex. Eventually, sine wave pattern and risk of cardiac arrest. This patient with renal failure, KT excretion, missed dialysis and developed hyperkalemia, leading to characteristic EKG changes. Clinical Vignette 3. Potassium regulation mechanism. Which hormone plays the most significant role in promoting potassium excretion in the distal nephron? A. Antidiuretic hormone, B. Aldosterone, C. Insulin, D. Parathyroid hormone, PT, aldosterone. Explanation. Aldosterone increases potassium excretion by stimulating Na-pi reabsorption and K-pi secretion in the principal cells of the collecting duct. Insulin shifts K-pis into cells, but doesn't promote excretion. PTH regulates calcium, not potassium. ADH affects water reabsorption. Let me know if you'd like case questions on hypokalemia